I'm good, thank you. I'm not going to read anything from her very
Okay,
full and complete bio. I'm going to let her share what.
okay, we are now being recorded.
Okay,
So Jillian started the recording. So, um, but, and I'm sure we will add more people as we get going, but good morning, good afternoon.
yeah, it's barely
And
close.
thank you all for, zooming in on our series of mental health Mondays in District 6440. If you have been on the Zoom before, you know that we cover a wide variety of topics relating to mental health. And we are thrilled that you are taking half an hour of your precious time to join us on the first Monday of every month at noon. And with that, I'm going to turn this over to Sharon Weingarten, who is our organizer for our speakers, and she will introduce our speaker for today.
It is. I'm Sharon Weingarten from the Wilmette Club, and honored to introduce my friend Cassy Horton, who it will introduce herself. She's speaking on an important topic that has not been addressed, to my knowledge, anywhere. Cassy, unmute yourself and take it away. I want you to have all your time.
Yeah, great. Thank you so much, Sharon. And you've been an incredible supporter really since day one, before inception, honestly, within our community. Great to be here, everyone. My name's Cassy Horton. I'm the executive director of the nonprofit Pickles Group. We are homegrown, so we are founded by a group of families that I'll talk about from the North Shore area in the Chicago suburbs. And I'm gonna share my screen, but just really briefly, a little bit about me. My whole career and background has been focused on supporting kids and families navigating different challenges. I have traditionally worked with kids through the K through 12 public education system, worked for an after-school program working with marginalized kids from historically under-resourced neighborhoods, and then also worked in education policy, specifically with charter schools for almost a decade, but got connected to Pickles Group. A lot of the work that we do in our model is actually very similar to the peer-to-peer social emotional support program that I first worked for when I started my career. So one of the things about the work that we do is that we are focused on a specific group of young people, but a lot of the resources, approaches, all of that are transferable to kids who are going through any sort of unexpected challenge in their life. So I'll open up my slides. I'm going to try to get through in like 20 minutes so we can have time for questions and answers at the end. But really grateful to be here with all of you, and hopefully it's an opportunity for you to just learn a little bit about our organization and what we're up to, and a way to support kids in your community as well through a potential mental health challenge that they might be facing. So with that, let me see. I think I'm gonna, whoever is the in charge, I'm just requesting to be able to share my screen because I want to throw my slides up, and then it looks like that worked. So let me see if I can get it going. Okay, 1 second. All righty. I think folks can probably see. Can you just give me a thumbs up? Looks like Sharon.
Yeah, you're good.
Nod. Okay,
Mhm.
awesome.
Pardon me.
All right. So I'm going to give you a flavor. I'm going to go through actually, we just wrapped up a really successful end of year giving campaign, which I'm so grateful for. And the overarching umbrella for that was Mission Double the Impact. We're a young nonprofit, and this year our goal is to continue to double our reach in terms of the kids and families that we're supporting. So this is a flavor of what I shared with folks, supporters, partners during our end of year campaign. So a little bit about Pickles Group. Like I mentioned, you might have heard this story before, but we're founded by a group of parents from the North Shore in Chicago, from Wilmette and Winnetka. So you see up here, the Agnews, the Smiths, and the Lovaceks. These families came together around 2019. Mark Agnew, the father in the first picture, and Ned Smith, the father in the second picture, got connected through peers. Mark was diagnosed with stage 2 brain cancer with 4 kids at home, incurable brain cancer. Ned Smith was diagnosed with glioblastoma, a more aggressive form of brain cancer, with 4 kids at home, and it was right around the same time. Mark has been a professor at University of Chicago, an entrepreneur in the community. Ned was a professor at Northwestern, and so their respective networks, that they were going through the same thing, and said, you guys should talk. You live in the same community, you're going through something really challenging. Why don't you get together and see if you can compare notes? Right around the same time, the Lavacek family on the far right, mom Erica Lavacek was diagnosed with stage 4 small cell lung cancer. Her and her husband Jeff are pilots. We're pilots. Pilots have an increased exposure to radiation, UV, and get cancer at a much higher rate in terms of early onset cancer. So these folks came together, they started comparing notes, and with kids in elementary and middle school at home, the thing they really latched onto was this was incredibly hard for their kids, and they could not find support, even, with a great community, a great network, great schools, like great care providers. The support for their kids through this incredibly challenging thing was really lacking. And so that's what they kind of honed in on as a group. Like, if we can't find this, probably other folks cannot. Let's figure out how to problem solve for it. And the outcome was Pickles Group. They really started working with a woman who is now our chief clinical officer. She's both a therapist and a child life specialist. Her whole career and expertise has been supporting kids through trauma, grief, mental health challenges related to having some sort of medical related challenge. And she started providing basically a support group for their kids. It was extremely effective. And once they saw that this kind of support resource approach for their kids was working, that is how Pickles Group was born. And the nonprofit named Pickles Group, actually, this core group of kids who kind of ran our pilot program organically across the families, they came together on the first time they ever met all together to talk about their parents' cancer. And we're doing an icebreaker, figured out that they all love pickles. So that became their inside joke. They called themselves the Pickles Group. And that is how we got our name to get going. So I mentioned this already, but some of y'all might be very familiar with this already. We just had actually a month of awareness about children facing a parent's cancer in January. Cancer is on the rise with younger folks. We call it early onset cancer. So folks under the age of 50 are being diagnosed more and more. It's kind of a double-edged sword, because the good news is that folks are living longer. Our treatment, everything that we're doing to support folks, even if their cancer is not curable yet, folks are living longer, they're receiving better care. But the fact is that folks under the age of 50, that's really where we're seeing an increase in cancer diagnoses. And it's breast cancer, it's colon cancer. We're trying to figure out the causes. We suspect it's environmental, it's lifestyle, all of these different things. But that's the reality that we're dealing with. And so within parenting age adults, cancer is actually the second leading cause of death, unfortunately. And it's estimated that between 3 and 5 million kids are facing a parent's cancer right now. The back of the envelope math is 1 in 15 kids. So, you may be thinking like, I'm not even sure if I know anybody who's dealing with this. A lot of folks and a lot of kids are effectively suffering in silence. There's a lot of stigma about cancer, having conversations, parents' heads are spinning. So a lot of this is happening at home, and we don't even realize, who in our community is affected. Maybe they're hoping that treatment is easy and, is only going to take a couple months with surgery. They don't even want to share. They don't want their friends and family to know. So this is the reality that we're living in. And, we certainly hope that these trends reverse. We'd love to see a world where there's less kids, frankly, for us to serve. But right now, this is the reality that we're navigating. So about Pickles Group, we are laser focused on this subset of 1 in 15 kids. And our flagship, our anchor, where we really started is in the North Shore. So everything we do is focused on 3 things that are really transferable for kids' mental health across any sort of life challenge. But we drill down to this subset of young people. And that's honest, age-appropriate information. That means that we talk about cancer, which is incredibly hard for families, understandably. Just saying the C word, how do I explain to a 6-year-old, is a 15-year-old Googling and trying to figure it out themselves? How do we talk about what's going on? And that's a really key part of supporting the mental health of young people through any challenging thing. Cancer is even harder than a lot of other conversations we might be having with our young people. Coping skills is a huge part of what we do. So if kids haven't developed the language yet to figure out what are they feeling and what can they do about it, how can I cope? The day before my mom has a scan for her breast cancer recurrence, maybe I feel some tightness in my chest. Maybe I can't really pay attention at school. Like, what are you feeling? And what can we do to help you through that? And then the last piece is connection to peers. So the kids in our pilot group named it. They said, I feel really lonely. My friends at school don't get it. It's hard going through this and feeling isolated through this experience. If you've gone through anything related to cancer, you may have felt the same way. Like, the people in your community, they don't get it if they're not going through the same thing. That's how our kids feel. And this is common, but to some extent, it feels rare. Most kids we work with don't know another kid whose parent has been diagnosed with cancer. They've never met someone else they can talk to about this. So our whole theory of action is about connecting these kids so they can be with other kids who understand what they're going through. And this is really the baseline of the mental health, the peer support that we provide, these 3 things. So I'm going to speed up a little bit, but we do this through kind of a funnel of different resources. We provide free, super high quality booklet in Spanish and in English to hospitals, to schools all across the country. We call it our Family Cancer Support Kit. That helps families have this conversation, whether it's, how do I talk to my kids about the fact that I was just diagnosed with cancer? I have a surgery coming up. I have to change treatment. I just found out that maybe treatment is not going to be curative. Those are hard conversations. So we distribute this booklet. We also do live webinars to support families. And then we bring families into our programs, which are all about that peer connection with the kids. So we do in-person programming in Chicago. We also do a really high quality virtual 5-week program because what we see is that our families have a really hard time showing up to things consistently, which is understandable, right? Like, they're going through treatment. They're not sure what next week is going to look like. How am I going to feel after this first round of chemo? So virtual programming has been a really critical component of how we can meet families where they are while they're going through something challenging. And then we're piloting new ongoing support for families as well. And our North Shore Chicago home base is really where we're piloting some of this new ongoing support, monthly support groups for kids. And we tend to see that our kids who want to stay with us on an ongoing basis are from families facing an incurable cancer diagnosis. So there's not a world where cancer goes away. For some of our families, there is, it's 6 months of treatment and like, we don't want to talk about cancer anymore. And we get that and we support that. But for some of our families, they want to stick with us on an ongoing basis, and we provide support to that end as well. So you can kind of see here, in terms of meeting family needs, we kind of look at it like a funnel where lots of families can come to us just to have these conversations, access the webinars, access the booklets, do some coaching around resources. Our 5-week program really meets the needs of a diverse population of families. And then our ongoing support is really where we see families who are facing an incurable cancer stick with us. And just some statistics about the families that we serve and the kiddos that we serve. The most common cancer types that we see within our community on the parent side are breast, colon, brain, lung, and blood cancers. Those tend to be more common early onset cancers. 58% of our families, like I mentioned, face an advanced stage cancer. So they're really coming to us looking for ongoing support. And almost half of our families identify as Black, Latino, or Hispanic, Asian American, Pacific Islander, or multiracial. So, cancer does not discriminate. We're really serving families across a broad lived experience. And this number at the bottom actually is incorrect. We're closer to a third of our families qualify for free and reduced lunch. So we're always working to really increase inclusion across socioeconomic status as well. And as I shared, so we're only 3 years old. We're starting our 4th year right now. And during our first 3 years, each year we've doubled our reach and our impact. So in 2024, we wrapped up the year. We were able to support almost over 1,300 kids. We distributed nearly 20,000 family support kits. And then a really important part of what we do, we actually train. We do, webinars, trainings for oncology nurses, social workers, folks who work with the families, school social workers, to help them better support the parents. A lot of times they don't even know what to say when they've got a patient with kids at home. So that helps us recruit new families in, and you can kind of see that reach has really grown. So this is about double what we did in 2023. And we're hoping to double our reach again in 2025. So that's really what we're up to. We are all about awareness. And that's one of the reasons I'm so grateful for Sharon having us here today. Again, there's so many families navigating this. You probably know at least a handful in your own network, or you might see this come across, kind of your life soon. So we're really hoping to double our impact again this year. And I'll send the slides around. You can share them, Sharon, in case anybody wants to take a look. But this is a look at our team. We've got folks from education, youth services, the cancer support space. We've got 4 key staff who are helping us really execute. And that's a little bit about us there. And just grateful to be able to be with you today, and grateful, for great partners like the Rotary, who's invested in us before, to be able to find this really specific mental health need, this hardship, this adverse childhood experience, and lean in and get kids what they need as they're going through something that no family ever expects to face or wants to face, but it's just becoming more and more prevalent, unfortunately. And then a little bit about us, and then I'll open it up for dialogue and questions if y'all have questions. But some of the ways that you can get involved and support, like I said, it is all about awareness. So we're looking for any place that is the intersection of kids, mental health youth services, and the healthcare system. Like, that's really kind of our niche. So you can certainly follow us on social media, share with your community, share with families, hospitals. If you're going to your primary care physician, like, ask them, do you ever treat any patients who have cancer? All that good stuff. We can help you get resources into, whether it be the actual hospital or your primary care provider, your own pediatrician. Like, these are all great places for us to get the word out there. Schools, other nonprofits, American Cancer Society, like, who do you know who's working in the cancer space? We also recruit specifically graduate students. So I didn't get into the details on that, but the way we facilitate these groups and make this really scalable, we recruit students who are studying social work, psychology, child life, and nursing. And we give them a curriculum, we give them coaching and training. They facilitate our youth groups for the kids. That makes this program super scalable. It gives those folks training before they go off into the professional world. And the beautiful thing is, once, say, for example, if you go work as an oncology social worker at Northwestern and you've worked with us, like, you are just attuned to, are there kids at home? How can I help them? Is this a parent that I'm treating? All of that. So if you have any connections to graduate schools in that vein, that's great. If you know any grad students who might want to get involved, we'd love to have them as volunteers. Stay engaged. We're rolling out some new volunteer opportunities this year for folks to essentially be community ambassadors. So if you're interested in helping us get the word out, we'd love that. If you have a background along these lines and want to volunteer, we'd love to have you. And then we're also, in this growth stage, which we're so proud of, you know, to be able to reach more families, but also we need to be able to invest in our kids, and that requires financial support as well for us to be able to grow. So we're always looking for folks who want to give at the individual level, corporate, you know, if there's some family foundation, you know, and you think they might be interested in our work, I'm always grateful for introductions and support along those lines. So that's a little bit about us, and I will wrap up, and I'm happy to listen, answer questions, all that good stuff. But just grateful to be here with all of you today and for you taking the time to learn more. And with that all, I'm going to stop sharing so I can see everybody's faces. Any questions? It looks like there might be some in the chat.
Before you have questions, I'd like to clarify something, or expand on something I said earlier when I said, not to my knowledge, not happened before. Being one of those families who have had experience with cancer, there are groups for parents in wonderful hospitals, even in some schools, for parents to deal with children who are ill. But in doing some research, I have found nothing else to help the children who are dealing with cancer in the family, which drew me to this subject immensely. So, Cassy, take questions if you have.
Yeah, totally. I'm going to just skim through the chat really quickly to address some of the comments and things, and then I'll open it up if anybody wants to go off mute. So, George, great question here. Are the kits available in different languages? So right now we have English and Spanish, and we started with the two primary languages where we get the most kind of requests. We have the most reach. Also, folks are probably familiar with this in terms of making sure that things are culturally relevant and thoughtful. It's more than just translating the language a lot of times. So we worked really thoughtfully with partners who are focused on serving Latino and Hispanic families, and we've been able to make sure the Spanish language support kit is really high quality. And we'll continue, we are committed to serving more families across different languages, but right now, that's where we are, is English and Spanish. So no other languages just yet, but I know there will be in the future for sure. So that's the answer to that question. John, thank you. I really appreciate the support and ongoing communication. Greg, I see your comment about rainbows. So thank you for that. Really appreciate it. We love Rainbows. They are an incredible organization, and we have had a lot of conversations with them about collaborating and sharing best practices. If folks don't know, Rainbows is actually, I think, international, not even just national. I think they serve folks all over the world. And we've really been like learning, comparing, and contrasting our models from them. But they do a lot specifically around bereavement. So they're one of our partners, like when kids lose a parent, they do all different kinds of bereavement. So, you know, kiddos might lose a parent from a car crash or from cancer, but they do bereavement support for those kids, and they do a really great job. An interesting thing, I didn't talk about this in detail, but to start, we didn't want to like boil the ocean, so to speak, and do everything all at once. We wanted to be really focused. And so we started with an ill parent focus and curriculum, as I mentioned. But inevitably, because so many of our families are facing an advanced stage cancer, we do have kids and families who lose a parent along the way. And Rainbows is a type of organization that we would refer to who's focused on bereavement. And that's how we started, because we wanted to be able to focus on the ill parent piece well, and get that really dialed in. What we started to pilot last fall is bereavement support, because we build all this trust up with families, you know, as they're in the lead up to losing somebody, and even like going through hospice care. How do I tell my kids I'm going to lose a parent? Not all families, but some families find it difficult to make a transition to a new organization, you know, after a loss. Like they'd rather keep their kids with Pickles group, is the feedback we got. So we are piloting our first bereavement program right now. And we don't want to be duplicative of other things out there, but we do want to be responsive to our families. And, a lot of them are saying like, thanks for the referral, but like, can I just stay with you guys? Things are really hard right now. And I know you, and my kids love you and all that good stuff. So we're kind of figuring out our way through that, but that's a great thought. Yeah, what's our service footprint from Kevin? Great question. So we started with an in-person program that is run out of Community House in Winnetka, and we still have that in-person program. We also saw that there's like a real need for families to have flexible options. And so we got up and running like right on the tail end of COVID. We also had a lot of immunocompromised parents who didn't want to take the risk, of like dropping their kid off for something else as vaccines were just becoming available. So we started a virtual program as well. And that has grown kind of like wildfire. So we serve families all across the country through virtual programming, but we've got this flagship in-person program in the North Shore of Chicago that we're working on figuring out how to replicate right now. So it could even be other in-person, on the south side of Chicago. We're talking to Rush about that right now. But those are kind of the two pieces that we've got, is the virtual and then the flagship in the North Shore of Chicago. We are piloting some in-person in Columbus, Ohio right now. One of our founding families from the North Shore, they're high school sweethearts from Columbus, Ohio. And so we've got a huge group of volunteers there who really wanted the program. So we're working on expansion of the in-person, but Chicago North, as we call it, is really kind of our flagship. And we get families from all over.
If I could follow up on that, and I appreciate it. So that service footprint locally, what does that look like? Who are your clients? Where are they from in the North Shore?
Yeah, great question. So this year we enrolled, I think it was exactly maybe 120 kids from like the North Shore catchment. We tend to get those kids referred to us. We work very closely with Northwestern Lake Forest Hospital, with it used to be North Shore, but now Endeavor Hospital and their cancer care center, the Kellogg Cancer Care Center. A lot of people travel for cancer care too, so they might be like going down to Rush for treatment, but they live in the North Shore. We probably get families who live as far away as maybe like 15 miles, which is less than ideal, but like they're willing to drive for in-person programming. Most of those folks though are pretty tight, drawn around kind of the Winnetka circle. We draw from and actually get a little bit of funding from the proximate townships, including the New Trier Township, because we serve kids disproportionately there. Yeah.
Thank you.
Yeah, great question. All right, let's see.
Cassie, I have a question I just thought about when you talked about other hospitals and so forth. Is this virtual programming replicable or able to be used in other countries, English-speaking countries?
Totally. Yeah. So we've built this really interesting partnership with this nonprofit called Nankind in Toronto. And they are focused on supporting moms with breast cancer. They've expanded out, but also they have a model where they send in basically volunteers to kind of supervise the kids to give mom a break. And so we talk to them all the time, and we're actually sharing our curriculum with them. There's a nonprofit in the UK that we're part of this collaborative group, like where we're sharing best practices with folks, and they're taking some of what we're doing. But I believe we've had folks request information from at least 15 different countries, including the Spanish language stuff that we're doing. A lot of folks from South America have been requesting the Spanish language stuff that we've put out. So the answer is like absolutely yes. And we try not to gatekeep, and we're very much, time zones are like the tricky thing with the virtual program we've found. But if Canada can make the time zones work. So if folks can show up and make the time zones work, Mexico too, then we're all for that. Let me see. I'm skimming through the questions here. Yes, Greg, I responded to your Immerman's Angels Comment. Johnny Immerman is on our board. He's amazing, and we love them. So you know what you're talking about, which I appreciate. What can individual Rotary clubs do to help beyond financial support? Yeah, it's a great question. So I think we're working on this by March. We're going to have more opportunity for folks to essentially be trained ambassadors. And even presentations like this are so helpful. But, you know, if it's a school, if, you know, you are connected, you're connected, all of you, right? Rotary, that's the bottom line. You're all thinking about the community. If you can help us spread the word to other organizations, we can get you trained as an ambassador, the schools in your community, other nonprofits. That's super helpful. So I'd love to come back to you once we've got that ambassadors module done. And if anybody's interested, it would be great to get you involved. Yeah, Advocate Luther General. So our Chief Clinical Officer, Cassy Horton, actually, that's where she was working as a child life specialist. We poached her out of Advocate. So we do have a relationship with that great hospital for sure.
I have a question, and it goes back to your model and how the programming that you do was developed. So I might have missed in their slides, who is your board, or who are your clinical professionals to make sure that the conversations are the right conversations, that they are age appropriate, that they are connecting to the children. How does that happen?
Yeah, totally. Great question. So, and I know we're close on time now, but our Chief Clinical Officer, Cassy Horton, is really one of the leading experts in this area, specifically across the country. So she is both a licensed therapist and a child life specialist, and she's the one who designs the curriculum and has put together the training and coaching. And then we consult with all sorts of different folks. So we've got like partners who maybe aren't doing exactly what we're doing, but you know, mentors in similar mental health space, like who give us feedback, help to review. And then same thing with our board. So we've got folks who worked in the nonprofit space, cancer survivors, mental health professionals on the board as well. So that's how we put it all together. But she's really the brains. I'm just here to like help do things like this to help get the word out. Yeah. Any other questions? I saw someone, or I heard, but I didn't see anyone.
You know what I was just thinking is I had the opportunity to spend, it was a very small Rotary club, but to spend a academic semester period of time in American Samoa, and became acquainted with the people who worked in the hospital there. Actually, I just wrote down his name. Would sharing the information you're doing with people who travel, the information you're sharing with people who travel with other, I would say more than just friends, but colleagues or Rotary clubs, so that perhaps a large organization can get behind this.
Yeah, absolutely. Absolutely. We're young and we're growing, and we have a lot of proof of concept in terms of the quality of our program. I didn't talk about that, but we've got social emotional evaluations, all this good stuff. But this is a widespread problem, and we're all about connecting with partners locally or, you know, anywhere, American Samoa, who can benefit from the resource, and who we can collaborate with. So absolutely, just keeping us in mind and spreading the word if you're traveling or whatever you're doing is really helpful. Certainly. Okay, well, I know we're at time. I want to be respectful of everybody. It's 30 minutes, correct? That was for a little lunch and learn. Okay, great. So yeah, just thank you for all the thoughts, all the engagement, really wonderful comments. And I'll send around a follow-up email I can send it to you, Sharon. Maybe you can forward to folks if we want to like get more involved, click on the links, like join the email list, all that good stuff. But just really appreciate all of you making space for mental health and for our young people, and making the world a little better, you know, through these lunches on Monday, and your support.
Thank you so much, Cassie. It's a pleasure seeing you and the work that you're doing. I know that our clubs are going to be responsive in some way, shape, or form because we are anxious to spread the word about a project and a program that's working to help our lives become better as families navigate very, very challenging times. So we'll use whatever resources we have here at District 6440 with our clubs to spread the word, and appreciate your presentation.
Thank you, everyone. Happy Monday, and take good care. Enjoy the rest of the week. Talk to you
Thank
soon.
you, Cassie.
Thank you.